The following recording is an extract from the BBS UK Medical Information Booklet and includes information about the learning and emotional difficulties and developmental delay experienced in Bardet-Biedl syndrome, BBS. Information about other features of BBS, genetics, diagnosis and family planning, the specialist BBS clinics and the charity, BBS UK can be found on the BBS UK YouTube channel and on the BBS UK website. The medical information booklet can also be downloaded from the BBS UK website www.bbsuk.org.uk. The information contained within the medical information booklet has been provided and checked by the BBS Specialist Clinics team and where possible is supported by research and published articles. A full list of references can be obtained from tonia.heimers@bbsuk.org.uk. Bardet-Biedl syndrome clinical features and presentation. Learning and emotional difficulties and developmental delay. Individuals with BBS often have mild to moderate learning disabilities. Some early studies overreport the level of difficulties, as they used tests which were not tailored to visual impairment. Although studies conclude that a significant number of patients experience significant learning difficulties, only a minority have a severe impairment on IQ testing. Often, a patient with BBS, and their parents alike, report a deficit in short-term memory, which is counterbalanced by excellent long-term memory. The majority of children with BBS are able to remain in mainstream education, provided adequate classroom assistance and/or low vision aids are available. Developmental delay is common in children who have BBS. Several components of development are often delayed, including speech and language development, general motor skills and, to a lesser extent, fine motor skills. In particular, sitting, standing and walking may be delayed by up to 1 year. Sometimes a child or young person with BBS will be labelled as rude or intellectually impaired because a requested response is delayed. There does seem to be some delay in the speed at which information can be processed. However, once decoded, the question is mainly answered in a reasoned and appropriate way. The delayed response phenomenon is widely reported by parents and teachers of children with BBS. Some common difficulties for children with BBS are emotional immaturity, poor reasoning, poor communication, psychological inflexibility, obsessional thinking, rigid routines, challenging behaviour, and inability to form friendships. Some children who have BBS receive a diagnosis of autism. There is a great variation in learning difficulties among the BBS population, with some individuals seemingly unaffected by learning or behavioural difficulties, and others who have severe autism and global developmental delay. For some children, much of this improves as they mature. However, emotional immaturity, poor reasoning, inflexibility, and obsessional thinking can carry on into adulthood. Between the ages of 7 to 12, there is typically an increasing awareness of the disability, and the feeling of being different is starting to emerge, particularly in the school setting. At this sensitive age, young people may have difficulty with friendships, obesity and bullying, resulting in low self-esteem. Fears, such as the daily management of any behaviour difficulties, education, living an independent life and having a relationship, start to set in for both the person affected by the syndrome and their family. Fitting in socially is very important, and the teenage years are when relationships and sexual functioning are major issues. Emotional detachment is common for any teenager, so suddenly not wanting to share everything or discuss things openly anymore can be difficult for parents who want to help. As with the general population, hormonal changes can also contribute to developing emotional difficulties, with people feeling lonely and unhappy. In adulthood, common concerns are worrying about medical conditions, not feeling in control of emotions, apathy and social skills problems, such as a lack of social life and finding a job. Individuals with autistic traits may have difficulty understanding other people's emotions and difficulty reading social cues, which makes it harder to relate to others. Independence is an issue for some, but not for others. Some people are able to do anything they want to do, whereas others find themselves understandably frustrated about the limitations that come with BBS. Depression, anxiety, panic attacks, anger, and poor emotional control commonly affect adults and young people with BBS. It is unclear whether this is part of the syndrome or an indirect result of it. Most likely, it is probably a combination of both. A small number of patients experience delusional thoughts and some develop periods of frank psychosis. If this is suspected, prompt referral for psychiatric opinion and therapy is warranted. Treatment/management plan. For young patients of preschool age, an education, health and care plan, previously called a statement, will ensure the child is fully supported. Parents/carers should contact the school/preschool and request a plan to be commenced. The school/preschool's SENCO, Special Educational Needs Coordinator, will coordinate the process and arrange for educational psychologist and sensory team involvement. Possible interventions for children would include assistance with school integration, behaviour therapies, speech therapy, family support, management of symptoms, sensory support, emotional support. It is important to get any associated learning difficulties, such as autism, diagnosed, as diagnosis could then lead to help from other areas. For adult patients, isolation can lead to anxiety and depression, and it is vital that appropriate support is in place. There are many ways to access support. Ask GP to arrange a social services assessment and occupational therapy assessment. Ask GP/social worker about local support groups for the disabled or visually impaired. Ask GP about counselling if more support is needed for low mood or anxiety. Talk to staff at a local disability centre/social worker about activities in the area. Contact BBS UK, formerly LNBBS. It may help to talk to others in the same situation. Exercise is vitally important for emotional and physical well-being. Local disabilities team/social worker will be able to help with claiming benefits, arranging support workers, carers or respite, and linking individuals into local services in the area. Parents and carers. It is really important that parents and carers receive support too. Parents and carers of BBS patients of all ages with health conditions can often become stressed and anxious about the condition and the difficulties of caring for someone with additional needs. There are many ways parents and carers can seek support. Ask GP to arrange a social services assessment and occupational therapy assessment. Ask GP about individual or couples counselling if more support is needed for low mood or anxiety or conflict arising in the family. Talk to staff at a local children's centre or child development centre about activities in the area for parents/carers. Contact BBS UK. It can sometimes help to talk to other parents/carers in the same situation. Exercise is important for emotional and physical well-being. Parents/carers should try to find some time for themselves. It is important to have me time, whether alone, with friends, or each other. Relationships often suffer when caring for someone with a health condition. Local children with disabilities team/social worker will be able to help with claiming benefits, arranging support workers, carers or respite, and linking families with local services in the area. Parent. We sometimes need to find a little time for ourselves. This normally involves a bike ride, a swim, a run, or simply relaxing over a drink with friends. This is important because it makes us function better as parents, and my advice to any parents of newly diagnosed Bardet Biedl children is to allow yourselves this time too, in whichever form it takes. This information is meant as a guide only. If you feel concerned about anything you have heard, please seek medical advice from your GP, consultant, or a member of the BBS Clinics team. We welcome your comments and feedback. Please send to info@bbsuk.org.uk or tonia.heimers@bbsuk.org.uk.